excited to be here to tell you about what we're doing in the blockchain space. So I'm going to start with a short story of a moose on a boat. Not blockchain yet. So earlier this month, the beginning of May, I journeyed down the West River in Vermont with a bunch of my friends, led by my husband, who's on the right. He's the one in the non-red, come find me, rafter helmet. He's been a raft guide for 15 years. And after we had just landed into an eddy, flat water, after an epic rapid, my friend looks into the forest and she said, I want to see a moose. And I nodded and I said, I want to see a moose in a boat. And I didn't think anything of it, just came out and said, I'd like to see a moose in a boat. And my friend Jeff turned around and he said, don't you think that's a bit unreasonable, a moose in a boat? That doesn't make any sense at all. Kind of thought about it for a second, and he said, wait, you wouldn't be where you are if your mind didn't imagine something like that. So yeah, that actually does make sense. A moose in a boat is pretty ridiculous, but that's immediately where my mind went. And when you're trying to bring blockchain and healthcare together, both really difficult areas, very difficult verticals, you kind of want to think of a moose in a boat so that you can have that hope that you can bring it into this industry. So a little bit about me and where we are and why we are where we are today. So I'm a former hospital administrator at Yale New Haven. So my background is hospital enterprise, healthcare enterprise. There I was responsible for growing the market share for the medicine and surgery service lines, so I learned how a hospital operates. I learned very quickly. I also managed a clinical program there for orthopedics. Before that, I worked at a community health center where we served the Medicaid population, dealt with a lot of data analytics, and I'm a Teach for America Corps member, also a lot of data analytics. A lot of what I've done in my career is data analytics, but working with a lot of different and disparate data sets and trying to come up with conclusions of those data sets. In each of those roles, I also saw the challenge of trying to get data to the people that needed it the most. And that it brings us to what we're doing at SimplyVital Health, and we are building the blockchain infrastructure that's safely adoptable by healthcare. You heard Dan mention the Bitcoin blockchain. If you're familiar with blockchain, you've also heard of the Ethereum blockchain. In healthcare specifically, from our background, from my background in hospital administration, all of our advisors and our board, we know that the Bitcoin blockchain and Ethereum blockchain could very likely face adoption resistance in healthcare enterprise. Healthcare consumers, it's probably going to be fine. But if a blockchain application has to go into the department, ITS department, and sit down and not be able to answer the question of where those servers sit, that could halt adoption. So what we've done instead is we're creating that infrastructure that's safely adoptable. It's what we call a public permission blockchain. And we say that it's HIPAA compatible. And what that means is that in order to power the blockchain, to provide the energy for the blockchain, you have to have a HIPAA compliant computer. And so what we see is that this will help us move into the transition of these two really difficult verticals, both healthcare and blockchain. So our infrastructure components that we're starting with is a platform for connecting care, but the most important piece of what we've built is what we call a key pair system. And this is really the main feature and the most important part of our protocol as it exists today. It is open source, which is really what we perceive is really important in blockchain. So anybody can access this key pair right now. What you do with this key pair is you can build an application using that key pair, and you can immediately connect into the blockchain, and you can use the blockchain properties. That key pair system is what's starting the development of what we call Health Nexus, that HIPAA-compatible blockchain that's safely adoptable by healthcare. So why is the key pair system so important? Is because it does what we really want to do, is govern access to digital assets. It's what allows that access of that data, buy, sell, and share data, and it's the foundation for the protocol. So you can think of the key pair like a hotel key. So when you go to a hotel, you receive a key, and you have your room, that access for that room for a certain period of time, and only your key can access that room. Stay there for 2 nights, then you leave. If you tried to go back in with that key, you wouldn't be able to access that room. That's the key pair. So it allows you very specific access to data so that you can view that data. It's your restricted data. Your particular view is different. You don't have the whole hotel. You have just that one room. And the reason why that key pair is so important is because it allows you to get really creative with data. So we've heard a lot about data silos. We've heard a lot about the inability to access those data silos. One of the most common requests we get as a blockchain company is this idea around a marketplace, the ability to buy, sell, and share healthcare data, which if you're not in healthcare sounds really scary and sounds weird, but it's already a multi-billion-dollar industry. But it's only at the top level of healthcare. So there are 3 companies in the healthcare industry that do a marketplace of data. These 3 companies, one of them brings in $3 billion of revenue each year by selling de-identified data. That's a lot of money. That's all of your data, de-identified, so don't worry, they don't have your name. But they do use that data for really important analyses. Research and development, market share. So how do I know that this marketplace exists? How do I know that this data is being sold? Is because we bought it at Yale. We spent a lot of money each year to buy data, and my role at Yale New Haven was to move through all those rows of data so that I could figure out where our next OB-GYN clinic needs to go. Where should we grow musculoskeletal? Should it be in Cheshire, Connecticut, or should it be in Windsor, Connecticut, and why? If we didn't have access to that data, we wouldn't have been able to do those analyses. So this data is really, really important, but it's locked up in that top layer. And that top layer is health insurance companies sell it to these data brokers, and the data brokers sell it back down to hospitals and researchers. Not just Yale, Pfizer spends $12 million each year buying de-identified healthcare data. Nobody else gets access to that opportunity other than health insurance companies. People are starting to realize the impact and the opportunity of healthcare data, being able to access it in a very safe and secure way. That's what you can do with a marketplace. That's what blockchain enables. That's what that key pair enables, is the ability to govern access to that data. That's a pretty easy analogy. The moose in the boat analogy really comes here with this health information marketplace. And being able to leverage blockchain technology, but not only blockchain, a token economy, to be able to create a truly self-sustaining, autonomous health information network. So if you've been in healthcare for a while, or even 5 years, you may have heard of what's called a health information exchange. $564 million from the federal government went into health information exchanges. Almost all of them have failed. And the reason why is because of 2 things. 1, a lack of trust, and 2, there was no business incentive to keep it going. Business incentive in healthcare sounds really weird, I know, but there has to be some reason for that data to move. A lot of people don't want that data to move. With a combination of the key pair system plus what we call smart contracts, which allow you to automatically identify and move that data and be able to access that data, you create this network, this network of trust to be able to move that access around. Dan mentioned it, Marceline mentioned it, but we want the patient to be able to govern access to their data, and blockchain really allows us to be able to do that. This is this is going to take us a little bit of time to get to. It's a little bit uncomfortable. Blockchain is new. Token economy is new. Using a cryptocurrency to be able to access data is new. And so that's really the moose in the boat idea, is getting to this point where we can have what we call on-chain, off-chain governance to create a truly sustainable model for health information movement in a network between parties of different clinical affiliations. And that doesn't happen now. So we in healthcare and blockchain, or in blockchain in general, we see the road and the path to innovation. It's gonna be really bumpy. We're gonna get through it. And we really, all of those in healthcare, any vertical, what we really need is the support so that as we're crashing through this innovation, as we're trying to explain the benefit around blockchain, around tokens and cryptocurrency, having the support and understanding of what we can get to, that moose in a boat, is really what we need. And that's, we at SimplyVital Health are really calling on those in the industry and the field to help us get to that point. So thank you.